and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, burns are one of the most common household injuries, especially among children. Well, burns are characterized by severe skin damage that causes the affected skin cells to die. Now, most people can recover from burn without serious health consequences, depending on the cause and degree of injury. So to discuss on the topic, we are being joined today by Dr. Bhupendra Sarma, Senior Consultant Surgeon and a burn specialist from Nemcare Hospital. So not to waste any more time, I'll straight away move to Doctor and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So today the topic which we have taken must be a very common topic for every household. We are going to talk on burn. We are going to talk on the effects, the consequences, and also how to prevent burn. Now, at first, I would like to ask you, what is the magnitude of problems of burn injuries worldwide in our country?
Thank you very much for inviting me to this talk. In fact, burns are the most common injury that causes or encountered by the human body, and probably the most difficult to be treated. And to speak the truth, though there is no definite data how many burns occur in all over the country,
Okay.
it is estimated that about 7 million people suffer from burn injuries all over our country every year. And out of them, about more than 2 lakhs of people require hospitalization. And similarly, these people do not get adequate treatment because we do not have adequate burn care centers all over our country, and hence majority of the people do not get the adequate treatment.
Okay.
So this is the magnitude of problem, because enough of burn patients, but we do not have enough of treatment facilities over the country.
All right. Now, Doctor, if we talk about who are the victims of burn injuries, who would be that?
Yeah. That is also important, because we see that majority of the victims, rather 80% of the victims are women in the younger ages and also the children. Because the women, they are mostly exposed to the open flame because they have to do a lot of household work, especially in the kitchen.
Right.
And the children who accompany their mother, they are also at risk, because a lot of time mother goes on cooking and they accompany them, and there will be some, mostly they suffer from hot liquid burn, what is we call scald injuries.
Okay. All right. So
Of course, one thing I must tell you that nowadays,
yes, please continue.
Yes. Nowadays, what happens because of the terrorist violence and increased road and traffic accidents, even the male people, and of course industrial accidents, the male people are also not uncommonly suffer from this type of injuries.
All right, viewers, we are having a fruitful discussion, and we have just started our discussion with Dr. Bhupendra Sarma. So if you have any queries, our numbers are flashed on your television screen. So if you have any queries regarding the topic that we have taken today, that is, we are talking on burn injuries, how to prevent burn. So please call up. The numbers are flashed on your television screens. Call up and ask your questions. And Dr. Bhupendra Sarma is with us today in Good Life, the health show, to hopefully give you all the answers. All right, now, Doctor, coming to you again, what are the causative agents of burn? What would be that?
Yeah, mostly what we find that is it is the open flame.
All right.
Which is the most common.
All right, Doctor, we will talk on that, but we have a caller at this point. Right, we will talk on the Doctor, we'll talk on the topic, but we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Hello, মই আপোনাৰ নম্বৰ প্ৰগ্ৰামটো চাই আছো। মোৰ সৰ্বপ্ৰিয় ল'ৰা এটা আছে। তাক মানে পৰিছিলে, মানে গৰম পানী পৰিছিল আজি 1.5 বছৰমান আগত। পুৰা যিখিনি দাগ, সেই দাগখিনি এতিয়ালৈকে যোৱা নাই।
হয়
সেইখিনি কাৰণে কেনেকুৱা ধৰণৰ ব্যৱস্থা ল'ব লাগিব
পৰাৰ দাগটো যাবলৈ আসলে পৰাৰ দাগ মানে আপুনি বগা পৰাৰ দাগ কৈছে না বগা পৰিছে নহয় জানো
ৰাইট
যদি বগা পৰিছে তেতিয়াহ'লে সেইটো দাগ যাবলৈ কিছু সময় লাগে 3-4 বছৰমান লাগিব লাহে লাহে যাবগে এইটোলৈ বিশেষ চিন্তা কৰিব লগা নাই
All right. Thank you so much for calling at this point in time. I'm sure the answer just doctor gave you must be benefited to you. Now, doctor, these are some of the concerns by the viewers who have just called up, and a lot of concerns would be there. So, for which our numbers are flashed on your television screens, and please call up and ask your queries. Now, talking about the causative agents of burn, doctor, you were saying something.
Yeah. I told that flame. Open flame is the most common cause of burn injuries.
Okay.
And then comes the scald, what is called a burn by hot liquids, maybe hot water, hot milk, or a hot curry, which is most commonly suffered by children. And thirdly, we get electrical burns, which are not uncommon amongst the young people because they are the most common sufferers of electrical burns. And then comes the chemical burns, where both acid as well as alkalis can be the cause of burn. And we also get some contact burn because of the hot substance being in contact with the skin. And lastly, of course, we also get sometimes a radiation burn when somebody takes deep X-ray therapy or cobalt therapy for other cancer diseases.
Okay.
And then also there may be burn injuries of the part where this radiation is given. Yeah.
All right. Now, doctor, the first thing one has to know is the first aid, isn't it? Now, if we talk about the first aid, so how should one extinguish if someone is watching someone getting burned, when seeing someone is burning? So what is the first thing to extinguish?
Yeah, this is very important part of the whole discussion because we find that people are not very aware about the first aid measures of these burn injuries.
Okay.
So whenever a person gets burn injuries, and if suppose the clothes are catching a fire, what happens because the patient generally he runs, and once he runs, then the fire increases more because oxygen it is exposed to oxygen.
Right.
That's why we always say that don't run, always stop. Drop on the ground and roll on the ground.
Okay.
So this is the first thing one must do if you are caught by fire. Secondly, we should pour water on the burn when it is burning to extinguish the fire.
Okay.
Because water is the most important and commonly available agent especially in the kitchen, where the majority of the burn injury occurs. And of course, the water can be poured for a distance without going near the person, so that you do not run the risk of burning yourself. And thirdly, water immediately cools down the tissues. Not only it extinguishes the fire, but also it cools down the tissues so the wound heals well. So water is the first aid, or water is the first thing that you should pour to extinguish the fire.
Okay.
Once the fire is extinguished,
Okay.
you should go on pouring over the burn wound again water till burning pain subsides.
All right. Now, doctor,
Most of the people, what they do, they want to pour some ice water.
Okay. Now, you're talking
Now,
about
ice
water,
water
but
is not to be used
But
because
does water
ice
lead to
causes-
blister, doctor?
You mean water lead to what?
Blister. Does water lead to blister formation?
Now, water is very no, blister is not to be worried about. And
Okay.
water does not cause blister formation.
Okay.
Water only cools down the tissues and extinguishes the fire. The blister formation is different. Blister formation occurs in superficial burns. That too because the skin is partially burned. So
Okay.
one should not worry about blister formation. And blister formation is not the cause of using water. That must be very clear about it.
All right. All right. Now, if we talk about the types
and after
of...
you have poured water,
Right. Please
now, I
continue.
have also to tell something more about the first aid.
Absolutely, absolutely.
Once you have poured water, one should not use anything over the burn wound.
Okay.
We have seen that majority of the people, they use a lot of things like toothpaste. Some people to use ghee. Some people use this grease. I have seen even ashes and whatnot. And one should not use all these type of things, because this can only damage the already devastated skin. And that's
Okay.
why one should only pour water, and while transported to the hospital, one can put a wet cloth over the wound and then go to the hospital. That is the most first important step in the first aid. Once you do it, then it reduces the size of the wound, and also it heals the wound quite early.
Okay.
So this is to be remembered. Nothing to be applied over the burn wound,
All right,
except
all right.
water.
So water is one of the most important useful thing to be poured, and putting a wet cloth just before reaching to the hospital is also recommendable. Well, doctor, is there any difference between first aid in electric and chemical burns? Is there any difference between both?
Once you are out of the electricity field, that means if somebody is caught in the electricity, he must be made out of the field by switching off the light. And then, of course, the treatment is same. That means you have to use water. Okay. And in chemical burns, it is very important that you thoroughly clean the whole part with thorough running water, so that nothing remains. Because if the chemical goes on sticking to the wound, it can go deep and cause more deeper burns. That is to be understood.
All right, so this is the difference. All right, doctor, we'll have a more conversation, but we have to go for a break. All right, viewers, we'll slip into a short break, but do come back soon, because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Puja, and we are having a fruitful discussion on burn, the types of burn, with Dr. Bhupendra Sharma. All right, doctor, coming back to you again now, there are several questions regarding the management of burn, and it has also become a challenge for doctors like you as well. Now, if we talk about how do you manage burn cases in your practice, and what are the problems to be faced? What do you have to say?
Yeah, this is a very good question, because most of the people think that once you are burnt, there is nothing. Probably it is the end of the life, but it's not so. Of course, it was a very bad, difficult time earlier, but nowadays the treatment of burns have improved a lot. And hence, if a proper treatment is given at proper time, at proper place, I think a person can definitely go for a very dignified life in the even after burns, one person suffers from burn. Now, what are the new methods that have come? I must tell you that once the patient comes to a burn center, in the early stage, the most important thing that fluid management, because as you know, a lot of fluid goes out of the burn wounds. So whenever a person is seen with burn injuries, the first and foremost thing that we give lot of intravenous fluids, and that fluid will replace the whatever fluid is lost to the burn wounds. And then, of course, there are some other measures by which we resuscitate the patient. Once the patient is resuscitated, the second important thing is to take care of the burn wound. Earlier, what happened? The treatment was that we go and do the dressings, and only after about 3 to 4 weeks' time, when the wound literally gradually becomes granulated, then skin grafting was done, and that was a long process. We found that
all right, doctor, we'll proceed. Yes,
40%, 50% burn.
All right, doctor, we will proceed with the conversation. We have a caller, so let's take the call.
Continue?
Let's take the call. We have a caller at this point in time. Hello.
Yeah, hello.
Yeah, hello. I can hear you. Please ask a question.
Yeah, sir,
Yeah.
when can we admit the patient to the hospital? What is the cause? What is the...
Yeah.
Hello?
Yeah. Please proceed
What
with
is
your
that? When we admit the hospital. Do you want to know how,
Yeah,
which
indication.
type
What
of
is the
patient we admit
indication?
into the hospital?
Yeah, yes. Who we can take to the hospital and
Yeah,
who we can treat
actually,
at the
any
home?
patient above 20% burn.
Okay.
Yeah, any patient above 20% burn, we call it a major burn. In an adult, we admit them. And if it is a child, above 10% is a major burn. So all these patients must be admitted. So we always admit them and treat them in the hospital. And I think it answers your question.
Yes.
Okay. Now,
Okay, thank you.
All
once
right.
the patient
Thank
is
you so
admitted, I
much.
have
Thank you
already
so
said
much for calling
that
at
we
this
treat
point
the
in time.
patient,
I'm sure
we
you must be benefited with the answer. Yes, doctor, please proceed.
Yeah. Then most important thing is how we take care of the burn wound.
Right.
Earlier it was only, I have said that is only dressings were done, these traditional dressings. But nowadays we have got a lot of burn wound covers, which we use in our unit also. And these burn unit covers has reduced the time of healing of the burn wound.
Okay.
And also it has reduced the number of dressings that is required. And that's why we use them, especially in superficial burns. We use a collagen sheet where it can be, where you can do the dressing only after 7 days. And most of the time they heal within 7 to 10 days. So similarly, some other deep burns, even we have got silver iron dressings and other dressings, which has definitely improved the burn dressing and also the healing of the wound. Then secondly, we nowadays in a deep burns where it is very full thickness burn, what we call, or third degree burn we call. In that case, we nowadays we do an early excision and skin grafting. That means once the patient is stabilized, maybe about 24 hours to 48 hours time, we take the patient to operation theater, we excise the whole dead burn tissues and then put skin graft over there from the same patient. And even in other places, some even donor skin is taken, that is skin from the bank. If it is not available in the patient's body, you can take in a large burn from skin bank and use the skin for covering the raw area that has been caused by excision. So that is called, that is a very, very important operation nowadays we do.
Okay.
And it has reduced the time of wound healing. It has reduced the stay of the hospital and definitely has improved the cosmetic results after that.
All right, so doctor, can we say that the treatments are advanced
third thing is
nowadays
very
and
important
advanced
thing that
treatments are there in the hospitals like where you are there?
Yes. We have got a very good tertiary care burn unit in our Nemkar hospital.
Okay.
Where we have got all facilities for treatment of this type, what I have said. And we have got burn wound covers. We do early excision and skin grafting. And also the most important thing, which people do not do really, that once the wound heals, it requires a pressure garment. That means pressure is required to be given over the healed burn wounds, which is not known by most of our people. And that's why what happens, the burn wound starts causing scar formation after about a month or so. So a person whose wound has healed, has gone out of the hospital, if he does not come back, then he will develop some scars. And the joints try to contract, and it leads to a very disabling deformities, and which are very, very difficult to treat. That's why we always give a pressure garment or pressure bandage once the wound heals, and that should be continued for 6 months to 1 year, depending on the type of burn and the nature of the patients and the availability of these resources. So that is an important thing which people should know, and they must come to the hospital even after the wound is healed. That is very, very important.
So visit to hospital.
These are the new methods now have been taken.
Absolutely.
And of course,
the new methods have to be followed so that you can be cured fully.
We call them.
Isn't
See,
it?
once the patient, surely they must come, and we definitely they can be followed up, and this is very, very important. And another thing I must tell you, if there is scar formation, one must do massage, because scars are dry and they try to contract. That's why massage is very, very important. Massage with some moisturizing cream is very, very important. You can use coconut oil or some moisturizing cream, which contains this heparin or elantoin, all these things, and then they become moist. And if the moist wound does not really contract much.
So as much as possible, the moisture of the skin is very important and need to be moisturized, isn't it?
Yeah. Yeah. And another person asked me about this white appearance.
Right.
People think that if you take egg, they get white appearance. But it is not correct.
Okay.
Because egg we always give to the patients of burns, because egg contains albumin. And patients lose a lot of albumin from the burn wounds. So egg should be given in large quantity. We give over 7 to 8 eggs per day in major burns.
Okay.
And it does not cause whitening of the skin. The whitening occurs because there is a pigment in the skin called melanin, which is burned because of the burning process. And as a result, when it heals, that does not come so easily, so that becomes white. But which passes of time, gradually this melanin pigment comes, and then it becomes again normal. So one should wait, this white appearance will go in, of course it takes years.
Well, Doctor,
4 years, 5 years.
Absolutely. Doctor,
But
what we have learned is a proper diet, a proper intake of fluid is also very important for these kind of patients, isn't it?
Yeah. Right. It's very, very important. And actually, majority of people do not know this about the pressure garments. That's why I have emphasized on that.
Okay.
And you should always come to the hospital, even if the burn wound is healed. And another thing I must tell you, that burn wounds require to be treated by expert people. Absolutely. It is not that any dresser can do a dressing, because that definitely damages the whole problem, causes the whole problem.
Okay.
That's why they should come to an expert people who knows about the burn treatment. Yeah.
It's always recommended to take an expert advice and to be treated in the hands of experts as well. Doctor, we are really short of time. So what advice would you like to give our viewers who are watching our show at this point in time?
The most important advice is one should know the first aid of burns. Because if you do give a good first aid, if you use water only, not ice, and do not apply anything over the burn wound, that will probably go a long way in giving a good result after the patient is treated well in the hospital. Secondly, you must go to the proper place at proper time. We should not delay to coming to the hospital. And thirdly, you must wear pressure garments after the wound heals, and must use massage, and come to the hospital whenever you are called, and continue your pressure garments and massage till the doctor says no to it. That is very, very important.
All right.
And on the last thing I must tell,
please
burn
continue.
Injuries are preventable also. Yeah. So if you are very careful, then you can even prevent burn injuries. 70% of the burn accidents are preventable. We are not careful, that's why. Of course, it takes a long time. If you do not have time, I cannot go it.
Right.
But this is very, very important, that prevention of burn is essential. And we have got a lot of prevention programs which we do from our own. And also we do a lot of training programs to doctors, nurses, and in the peripheral hospitals. We go to any place we are invited, and we can give wondrous training to doctors and nurses.
All right. All right, doctor, we have a last caller, so let's take the call and then let's hear in the question which he wants to ask. Hello?
Hello?
Hello, আমি শুনি আছো
মোৰ এটা কোৱেশ্চন আছে ছাৰৰ কাৰণে
সুধিব পাৰে প্ৰশ্নটো
মোৰ প্ৰশ্ন আছিলে মানে মোৰ চিনাকি এজন আংকল আছে তেওঁৰ হাতত অলপ 10% বাৰ্ণ হৈছিলে তাৰপিছত তেওঁক চেন্নাইলৈ লৈ গৈছিলে তাত আপোনাৰ স্কিন ক্ৰাফটিং কৰিছিলে তো এতিয়া হাত বাৰ্ণটো অলপ ভাল হৈছে ভাল পাইছে তেওঁ এতিয়া কিন্তু হাতটো অলপ ডিফৰ্ম হৈ গৈছে তেওঁ মানে ভালকৈ কাম চাম কৰিব পৰা নাই এই বিষয়ে ছাৰে কি সাজেষ্ট কৰিব বিচাৰে আৰু ফিউচাৰত কি কৰিব পাৰি
আসলতে স্কিন গ্ৰাফটিং কৰাৰ পাছতো তাৰ ওপৰত আপোনাৰ প্ৰেছাৰ বেণ্ডেজ বা প্ৰেছাৰ গাৰ্মেণ্ট দিব লাগে দিছিল নে বাৰু তেখেতক যদি দিয়া নাই তেতিয়াহ'লে প্ৰেছাৰ বেণ্ডেজ আৰু প্ৰেছাৰ গাৰ্মেণ্ট দিব লাগে প্ৰেছাৰ গাৰ্মেণ্ট আমি আসলতে আমাৰ এইটো জোখমাখ লৈ পেলাই কৰে আৰু সেই প্ৰেছাৰ গাৰ্মেণ্ট পিন্ধি থাকিলে আপোনাৰ এই যিটো আপোনাৰ ডিফৰ্মিটি বুলি কৈছে অলপ বিকৃত হৈছে বুলি কৈছে সেইটো নহ'ব সেইকাৰণে এইটো অতি আৱশ্যকীয় যে স্কিন গ্ৰাফটিং কৰক বা এনেকৈ বাৰ্ণটো হিল হৈ যাওক তাৰপিছত কিন্তু প্ৰেছাৰ গাৰ্মেণ্টটো খুব দৰকাৰ সেইটো যদি দিয়া নাই তেতিয়াহ'লে এতিয়াও দিব লাগে মোৰ এইটো আপোনালোকৰ পৰামৰ্শ
Okay, sir. Okay, thank you, sir.
All right. Thank you so much for calling at this point in time. I'm sure the question you have asked and doctor gave you the reply. You must be benefited with that and you will always follow the advice which he gave you. All right. Thank you so much, Dr. Bhupendra Sarma, for joining to Good Life, the health show. Your advice to our viewers must be benefited and thank you so much for all those consultations. And I hope the viewers who have watched our show must be benefited with all the answers you gave. Thank you so much for joining to Good Life, the health show. Well, viewers, with this, we have come to the end of the show and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.